It's an interesting question about the debate around quantity and quality of material, especially when we're now in a very busy and complicated biomarker testing situation with lots of targeted biomarkers as well as immunotherapy. And the honest answer is that both quality and quantity are important. I suppose the difference, if any, is that on the one hand, quality is everything, because if quality is poor, it doesn't matter how much tumour you have, you can't do anything with it. You know the old story, rubbish in, rubbish out. On the other hand, quantity is something we can perhaps do something about in terms of trying to improve our diagnostic biopsy strategy, improve the way we handle tissue in the laboratory to make sure we have enough, or we can extend the usefulness of the very limited resource that we actually have. So there are things we can do. And there have also been technological developments around quality and dealing with lower and lower quantities of material in the molecular lab. But those advances in chemistry and so on, I think, are kind of limited, and we might be already at a point where there's not a great deal we can do to make big changes. I think the big changes in terms of solving some of our problems are firstly at the door of the pathologists to be a lot more economical and careful with what they do, because there's a criminally large amount of material gets wasted often. But also our interventionalists need to try and help us within the context of safety in the patient to trying to get more diagnostic material from the patient if it's at all possible.